Good morning. I was just going to say good afternoon, but we're actually still in the morning, Pacific time. Welcome. My name is Scott Pinsky. You're here at the Marin Coalition event, our first event for 2021, an auspicious year, hopefully a better year. Our first event of the year is entitled Challenges, Strategies, and Opportunities for Marin Seniors. My name is Scott Pinsky. I'm the chair of the Marin Coalition. As most of you know, due to the pandemic, we're presenting all of our programs virtually and free to the public on Zoom this year so far. We don't know when we'll get back to in-person events, hopefully sooner rather than later, but for now, we are doing the safe thing and presenting all of our programs on Zoom. So we're happy that you're able to join us despite the weather. Before we begin, I'd like to tell you a little bit about our next event. This will be on Tuesday, February 16, beginning at noon. So then I can say good afternoon when I start us off. That event will feature David Kuhnhart, the Vice Mayor of Corte Madera. David will present a discussion that he has entitled Climate Change, Realities and Solutions. This is an issue on which he has considerable expertise and has many years of dedicated involvement. And I know you're going to want to hear his perspectives on the issue. The presentation again will be on Tuesday, February 16 at noon, also on Zoom. We will be sending out a flyer to everyone on our email list, inviting you to register. And that email will go out within the next day or so. If you're not on our email list, please go on our website and sign up if you would like to do so. For those of you who do not know, we are an all-volunteer nonprofit public affairs forum located here in Marin County. We welcome all of you to become members if you would like, and you can visit us on our website, marincoalition.org, where you can also see videos of our past programs. For today's program, we're asking that you send your questions to us for the Q&A session via the Q&A tab, which is at the bottom of your Zoom window. So if you just go to the bottom, you'll see a Q&A. Click on that. You can type in your question. And once the presenters have finished their presentations, I'll jump back on and I will attempt to moderate all of your questions in the time we have remaining. And I'll get as many of those in as we can. Today, we're honored to have three guests to present on our topic, beginning with Lee Pullen. Lee is the director of the Office of Aging and Adult Services for Marin County. Hello. He holds his MS in clinical psychology and has held numerous mental health, social welfare, and executive positions. Lee has been a leader in community-wide planning and policy development. He has sponsored legislation on elder adult abuse and has helped to develop support systems for older adults and persons with disabilities. So without further ado, allow me to present Lee Pullen. Take it away, Lee. Thank you.
Thank you so much, Scott, and thank you, Alan, and the Marin Coalition for having us here today to talk about what we see on Marin's aging landscape, some of the challenges that we face, what we know and understand, and what opportunities exist. I'm going to share my screen, so just 1 second there, please. And start here. So again, thank you. Lee Pullen, you're County of Marin's Office of Aging and Adult Services, where our motto is to live long, live well. We work toward people doing that and having a good quality of life as they live out their lives here in Marin County. We're guided by our mission, which is to promote the health, safety, and well-being of people so that they can live long and have a good quality of life. As I talk in the next few minutes, I'd like to share with you what we do in your office through direct programs and services that we have with contracts with many community-based organizations. I want to let you know about some things that we know from our assessment of the older adult population, which, just using the federal definition, seems pretty young, but it's 60 and over, and talk about some projects we have to address those challenges and opportunities. As we do our work each day, thinking of that mission of health, safety, and well-being, we are also guided by a vision that Marin will be an age-friendly, livable community for all. And if you look around this kaleidoscope here, you'll see different elements. And these are elements that the World Health Organization and AARP came up with about 12 to 15 years ago as they started looking at our older adult population across the globe. So they said, what do we need for cities and communities to have in place for older persons to live well? And you can see mobility, housing, health and community services. What we're doing this morning, community participation and civic engagement. Right there at the top, respect and social inclusion. And well, it's so apropos for Marin that we added disaster preparedness. And if you think about this, these are things everybody needs. So we think when we build out an age-friendly community, that we're making a community that's livable for people of all ages. And cities and towns and counties that want to participate and develop plans can join this global network. We, the county, did a couple of years ago and came up with our plan last year. I'll share that with you in a few minutes. And right now, 9 out of 11 of your cities and towns are in various stages of looking at what they do to make their cities and towns more age-friendly. Some direct work that we do in your office, our Adult Protective Services program. It's set up to look into situations of abuse, neglect, mistreatment of older adults and younger people who may have a dependency where they can't exercise their own rights. Once we get a call, a referral, our team of social workers or nurses will go out and investigate that situation. It could be, sadly, where someone's being neglected, physically mistreated. In a lot of cases we get are financial abuse, where the person is, again, sadly being exploited by a family member, maybe a service provider, or so many scams that we see coming in that people end up, falling for. So our aim there is to work with the person to the degree that they're the victim, to the degree that they want us to get measures in place to stop that type of abuse from happening and hopefully not happening again. Another program related to safety is our long-term care ombudsman office. It's made up of staff and volunteers whose role is to be the voice and advocates for people living in skilled nursing homes, assisted living, boarding cares. Again, it could be a situation where perhaps the resident, things aren't going so well in the place that they're at. Perhaps they too are being victimized, even though they're in a facility by someone from the outside, perhaps taking financial advantage of them. And again, to the degree that that person wants, we'll get involved and and look at what we can do to get that situation resolved. Quite a year for long-term care ombudsman, and maybe we'll talk a little more about that later. The only program that we have in aging and adult services that's economically means tested is our in-home support services program, and that provides for Medi-Cal low-income individuals who have a disability of any age to receive care at home for shopping, cooking, cleaning, and personal care. Our social workers do an assessment, come up with an amount of time the person needs, and then they can hire whomever they want. And often it's a family member. If they don't have someone, we have an adjunct agency called IHSS Public Authority that'll help them find someone. Also, a big part of our operations is our Area Agency on Aging. Area agencies are set up all across the country under the Federal Health and Human Services Administration. There are about 600 of them. Most of them are actually nonprofits. Here in Marin County, we are a part of the county structure, reporting up through Health and Human Services. The Board of Supervisors would serve as my board of directors, and we're established through the Older Americans Act. It first came about in 1965 and has been reauthorized since, and it sets us up with these mandates that we are to plan. We're to plan for the needs of people 60 plus. Every 4 years, we go out and do a needs assessment and ask what's important to you, what's of concern to you. And well, too bad for us, it doesn't necessarily mean more funding is coming in. So we do what we can to work with community groups such as yourselves to get change to happen where it needs to happen. We're also an administrator of federal funds that come in. Not so much, about $1.5 million, a little more this year because of the CARES Act. And we take those funds and in most all instances contract them out with community-based organizations for a variety of services. And I'll show you some of those in just a second. We're also mandated as an area agency on aging to collaborate and advocate. So what I'm doing here today is collaboration. We are kind of have the agency, if you will, to get involved in any matters that are pertaining to people over the age of 60. It could be housing, it could be transportation, it could be healthcare. And where most of our advocacy comes from is through our advisory council. Every area agency is required to have an advisory council. For us, it's our 23-member Commission on Aging. And I'm really pleased that we have our Vice Chair, Diana Lopez, with us today. And she also chairs our legislative committee where much of our advocacy comes from. I mentioned community partners. I should really call this contracted partners because we have certainly more partners in this, but these are agencies with whom we direct some of that federal funds. It could be home delivered meals with Vivalon. We have a caregiver respite program with Jewish Family and Children's Services, along with the Alzheimer's Association and West Marin Senior Services. Again, not means tested. So if you're 60 plus, you're eligible for these programs. Now, we do have to manage our budgets, and we do try to prioritize, low income and so forth, but otherwise open to anyone over the age of 60. So for instance, if you're looking for caregiver relief, maybe you need to take a break for 2 days. We have that program, the Family Caregiver Support through Jewish Family and Children's Services. And we're doing some employment work now with the YWCA as examples. I mentioned that we do an area plan every 4 years. In the fall, late summer, fall of 2019, for the first time ever, I was very excited to be able to do this. We did a randomized phone survey, which means that you think in terms of the Gallup poll and those kind of organizations. We hired a professional organization to do this. And it means we can, for the first time, take the sample size of the people we surveyed and for the most part, generalize it to the overall 60 plus population in Marin. And so when we asked them, about what were their concerns, these are the ones that came up most frequently. And by far, it was climate change and disasters, fire, flood, and earthquake. And this, of course, was before pandemic. We didn't think to ask about that. I don't think anybody has to say anything about pandemic. So maybe now we did it again. That would also be one of them. But there are various activities happening around these issues, climate change. There's the Drawdown Marin project, and we're doing quite a bit of work with community organizations around disaster preparedness. Financial matters, people are concerned about being able to afford their health care. They're concerned about financial security, and it's just not the ones who are barely at the public assistance level. We have many people in Marin who are older are worried about running out of money. They have some savings now, but the benefit of the longevity boom is also creating this concern of, will I have enough to make it? And then losing memory cognition, I think, something that's on many of our minds as we progress through the decades. Our needs assessment survey revealed, we sort of knew it, but it verified the inequities, unfortunately, that exist among our 60 plus population. And those affect women, low income, and people of color the most. For women in our society here in Marin, women feel excluded or devalued because of their age much more than men. They are actually express more concern about some of those issues that I mentioned, and they're more likely to eat alone. Look at that, it's 21% versus 7%. And why is that a concern? It's a concern because every study shows that for most people consistently just eating by themselves, their nutrition is not as good, and that leads to physical health, and just the loneliness leads to psychological health problems as well. Looking at income, people who are lower income, and I'm going to say that's a good quarter of our population, they report poor health, they report less of a quality of life, they're more likely to be living alone. You can see there at the bottom, they also end up eating alone more. And right there, that third bullet, they don't feel respected as a member of our community. And I think, it's important to know so right now, we're at about 30% of our population 60 plus. That's about 75,000 people. And a good quarter of them, like I said, are struggling every month to make ends meet. About 1 out of 5, they don't receive public assistance because they're just over that threshold, but they can't handle a financial expense of fixing the roof or paying for caregivers. So we need to understand that this is a pretty significant inequity that we have here in Marin around income. And then older adults of color, they are more likely to be food insecure, fairly significant there. They too, look at that, 19 versus 3% reported that they don't feel valued and respected in our community. So I think we have some work to do there to have everyone. You'll recall that kaleidoscope I just put up right at the top. To have a good community, we need to have respect and social inclusion for all. And then when we look at their economics, they're still working, but when they look for a job, 20% versus 4%, they were not able to find a job in the last year. And that leads me to policy and advocacy. I'm gonna invite you all, I don't know who all's in the audience this morning, but we all have a role in working toward there being good policy, good programs, and advocating on matters that are important to older adults, and in particular those who aren't able to share in the beauty and bounty of Marin. So we do it at the local level, the state level. A lot is done through our commission there. And then I'm a part of a national association where we do our advocacy with members of Congress around the Older Americans Act and funding and so forth that comes in. Back to those elements of an age-friendly community, just wanted to share with you that we, the county, adopted a plan, or the board of supervisors adopted a plan for us last year. I managed to keep it on life support through the spring and summer, and we're now into full implementation. It's about what can we do to make our county departments age-friendly, that we really change, so that we really change it, that when a department is making a decision, they're making a policy, they're setting up a program, that they ask the question, what about older adults? How will this affect older adults? Will it benefit older adults? And if it's not going to, and certainly if it's going to harm older adults, let's rethink this. So whether it's our parks and libraries who are doing great work, human resources, and even our tax assessor's office, we want to make it a welcome place and an age-minded place when people interact with the county departments. We're also there to support our unincorporated areas. So think Tam Valley, Marin City, all of West Marin, and helping them decide what's important for their communities to live long and live well. So these are the areas that we're working on now. You can see them there, many various groups happening to address some of those challenges and opportunities that we talked about. And before I conclude, it's often I hear from people, I don't know where to go or where to turn if I'm looking for information and assistance. Well, we have a place. We call this One Door. It's a partnership between my office, Aging and Adult Services, and the Marin Center for Independent Living. We are officially designated by the state as an Aging and Disability Resource Connection. And the concept, I know for people, it's like, well, I'm older, that doesn't mean I have a disability, or I'm younger, that doesn't, don't equate me with being older. But yet when we look at what's the basics of what people need, it can be the same. So whether you're a younger person with a disability wanting to know what employment or housing options may be available for you, or you're an older person with the same question, the concept is you won't get a big run around. One door, you'll come in here and we will help you not experience a maze. So what we offer is that enhanced part means information and assistance that we will follow up with you, make sure those phone numbers work. If you need more than that, we're happy to sit down with you or on the phone, on Zoom, and talk about what's important in your life. What are you trying to get at? Are you trying to make a decision about, should I downsize? Should I convert my master bedroom to a junior accessory dwelling unit? And we're not going to tell you what to do. We're just going to help provide some counseling around that. We also help people move from skilled nursing back to home to get the support so they don't have to live in an institutional care if that's not what they want and there are enough supports in the community. And then if you need more than some phone numbers and a conversation or two, you need a little more hand-holding, we're there for up to 90 days short-term service coordination to help you avert if there's some kind of crisis impending in your life. So give us a call, 473-INFO. We also have a website, which I'm going to show you in a second, livelonglivewellmarin.org. We have an online community resource guide there to help you access resources and information that you might need. We're doing all that because we want to get back to this aim of people living long and living well and out in the community. It's a fun group up in Novato, Margaret, Todd, Alma, Latina, having a celebration when we all could. So let's keep moving toward that direction. And thank you so much. And Scott, I'm going to turn it back to you.
Lee, thank you. Boy, that really covered the waterfront, and I really appreciate the thoroughness. We typically are able to get the presentations put into either an email or some other format on our website so that folks can have access to your slides. So hopefully, Joe will be able to get that from you after the program, and then we can make it available for members of the audience if they would like.
Yeah, absolutely. So we'll have our phone number and our website. So thank you.
Great, terrific. Thanks again. Okay, we now move to Joe here. Joe is the CEO for the Marin Senior Coordinating Council, now known as Vivalon, a position that Joe has held for 11 years, but you probably know him through the former name of the organization, Whistle Stop, which, as I understand it, continues to be used as a name for a section of the services that are provided by the center, the transportation division of that organization. And correct me if I'm wrong, Joe, when you give your introduction. For
Sure.
a couple more days, if I'm allowed to say this, Joe will be leading the Vivillon mission, and then thereafter he will be handing over the controls to a new administration. But it's been his job to ensure that every adult has the opportunity to age with independence, dignity, and grace, and that's been his undertaking for over the last decade. For the past 20 years, Joe has been providing executive leadership to nonprofits throughout the Bay Area. Prior to his tenure in the nonprofit sector, he spent over 25 years in the healthcare industry. He helped found and now serves on the steering committee for the Marin Aging Action Initiative, a collaborative network that promotes a healthy, safe, and engaging quality of life for all older adults to thrive in the Marin community. So without further ado, let me present Joe. There you go.
Well, thank you, Scott. Thank you for that kind introduction, and thank you to the Marin Coalition for presenting this important topic to the community. And thanks to all the members of the audience who are with us today. And I'm going to share my screen and go through a brief presentation. Let's see, it's hopefully, let's see, it's the one. Good. So it does work. Technology does work. That's always the first thing we're challenged with. But I'd like to just follow up on Lee's presentation and give you sort of a history of the field of aging in Marin County, and also what's happening presently and what the future looks like. And I think it's important for the audience and the community to really get a capsule of what this field is all about and how important it is to the community. And our first message is that we all share this responsibility. As Lee mentioned, we're one of the oldest counties, and therefore we have many older adult friends, families, and neighbors. And that's a community responsibility. And that's one of the things that we want to sort of stress. Let me see, let's see, advance the slide. Okay. So about the history, it goes back to the early 1950s. And many of you may recognize this individual, but this is Vera Schultz. She was considered the first lady of Marin. And back in the early 1950s was the first female elected to the Marin County Board of Supervisors. And there's some great books written about Vera, which I've read. And one of her passions and one of her real policies that she pioneered was what we were going to do with the older population in Marin County. So we have a rich history in Marin of dealing with the aging, the challenges of an aging community. Vera was one of the first individuals from the West Coast to attend the President's Council, White House Council on Aging in America in the early 1950s. This was really way ahead of its time. And she brought a lot of those ideas back to the Marin County Board of Supervisors, and herself, the Board of Supervisors, and a group of dedicated citizens formed a nonprofit organization back in 1954 called the Marin Senior Coordinating Council, with the sole purpose of making sure that we did take care of our aging population. And it's very interesting, the report that they did back then, the same issues that they identified back then are the ones that we see today, just the magnitude of need has really driven. So I'm just going to take you through a little trip down memory lane. Some of you may appreciate these sort of historical photos, but first and foremost, transportation was needed for our senior population here in Marin. And this actually is the first vehicle that provided rides for older adults into the community, whether they were going to a doctor appointment or going grocery shopping. So this was the first vehicle. And then obviously there were certain older adults that needed assistance. And this is the first wheelchair accessible van that was provided to Marin residents needing special assistance to get to places within the community. Very important. This is the fleet of Whistle Stop Wheels vehicles. As Scott mentioned, people know us because of our buses. They're all over the county, and it's a large fleet now, but this is what it looked like back in the early 1970s. That's actually where the SMART train is running by our building right now. Lee mentioned nutrition, and nutrition is very strongly connected to socialization for our elder population. a meal is a social environment and social engagement, as well as the importance of getting healthy nutrition daily into our older adult population. So this was our senior center back in the early 1970s. This is probably a lunch that was going on. And it was the hot spot in Marin County to go in the evenings. There were cocktail parties, there were dinners, there were dances, there was socialization, there were group trips planned. This became sort of the hub of socialization and addressing the individual needs of our older adult population way back then. There were times, obviously, when older adults couldn't come into a center like that we have in downtown San Rafael or throughout the county. There are other centers. So we had to push services out to those that were homebound. And probably the most important one known is, as Lee mentioned, is delivering meals at home to those that couldn't get out of their home. So the Meals on Wheels program became a very vital service to those that could not, as I said, really participate actively in the community because of their being homebound. And the other thing that is important is socialization and really keeping older adults feeling a vibrant part of the community with socialization, with arts and entertainments. This is an example of a piano concert going on in the 1970s at our center. And what we've learned certainly then and what we learn now is the importance of aging services as they complement the healthcare system, particularly for the elderly population. So there is a connection that organizations like Vivillon and other nonprofits in Marin do, direct connection and benefit to the healthcare system in America and in Marin that are really helping being the eyes and ears of the doctors and the nurses to support what plan of care is being proposed for an individual or their family. So that just gives you a quick history down memory lane, and it leads to, very interestingly, as I said, our same core services that were offered over the last 67 plus years: transportation, nutrition, social connection, and preventive health activities, and information and assistance to the families are the same ones that we offer today. It's just by the magnitude right now, we touch the lives and help over 14,000 individual older adults and family members and people with disabilities. And that number continues to grow, which is what I want to sort of describe to you on sort of what's the present situation having to do with aging. How is aging changing within our community? Well, there are two driving factors. Longer life expectancy, people are living longer, and I'll show you what that's about. And therefore, the way they've lived their lives in their houses, when they were raising families, now that they're older adults, there's sort of a shift in the where and how they live is really needing to change. So just quickly on life expectancy, we partner with the Buck Institute on Aging Research that's up in Nevada. You probably are familiar with that, but they do a lot of work on looking at life expectancy. And this is an interesting chart that shows that I was born in 1951, I'll be 70 next month. Back then, the average life expectancy in the US was 68 years old. Now you fast forward to today, it's in the high 80s. And by the end of this century, the average life expectancy of an American citizen will be almost 100 years old. So you can see how this is rapidly changing over this period of time and how it's going to really change the way communities have to support their population. And the fastest growing sector of the population, not only in Marin and in California, but in the United States and actually all over the world, is the fastest growing sector of population is over the age of 85. So think about that. Communities, the way they were built, the way housing was developed, the way healthcare has been provided, really never thought of or imagined the population living to this elder state. So there has to be a real need and understanding of what we need to do as a community to support this aging population. Now here's a slide. When I show it, everybody loves this slide. This is, in fact, a worldwide phenomenon that's happening, so much so that the World Health Organization has really had to redefine the way we segment the population. And so now they look at birth to 17 years old as underage, and that's for people that have teenagers. You'll probably agree, that's an interesting word, underage. 18 to 65 are youth or young people. That's exciting. This is the one I love because I'm in this fragment or sector, and I'm sure many of you maybe on the audience are. 66 to 79 years old is considered middle-aged. So you don't hit elderly until you're 80 to 99, and now they've even had to create a category of 100 plus at long-lived elderly. So this is a worldwide phenomenon that's happening. There will be more people on the planet over the age of 60 than under the age of the 15 since they've been recording civilization. So we really have to change the way we look at our communities and how they're built and how they support the population. And in Marin, Lee mentioned a couple of these statistics. I just mentioned two here. The voting power in Marin is with the older adult population. 95% of registered voters over the age of 60. There's no other segment of the population that has such a large section of voting. So when we think about how the community should be run, should be focused on, it's the older adults that can really impact what goes on in Marin. The downside is that we have almost 20% of the population over 65 lives alone. That's almost 16,000. Most of them are widowed women, and they are considered elder orphans. And the reason they're important is because typically the family is the caregiver for older adults. However, the children of these older adults can't afford to live in Marin County, and that's why we have this very tender needs population of the 65 plus that live alone. And this is our poster, what we call our poster lady for aging gracefully. This is Pauline Engelman, who just turned 112 last year and is going as strong as you can imagine. For those that know her, she's just quite an incredible woman who is living, still writes notes, still calls, still visits. She doesn't use any walker, but she lives alone in Corte Madera with a good network of community and neighborhood support. So this is where the future is going in our communities. So how do we take care of and how do we help those like Pauline who are still living a very fruitful and contributing life in the later stages of their lives? One of the important things we've been looking at in the present and the future, and it's being realized by the healthcare, is that genetics and medical care represent about 40% of care for the elder population. The rest is social, environmental, behavioral factors are what really drive health and having an active, healthy aging life. So we and all the other community organizations and the researchers are really looking at the intersection of healthcare with these community-based services that we're offering that are so vital. And probably the most number one area is what's considered isolation and loneliness. It's becoming a national and a global and a local public health crisis. And nothing has illustrated more what isolation and loneliness means than we all are going through the pandemic. And all are experiencing, quite honestly, what an older adult living alone sees every day and deals without a pandemic, feels and the needs they have are really been exaggerated during the pandemic. And I think the rest of the community is starting to understand what isolation and loneliness means. Its long-term health impact can be very significant. So a lot of the work that Vivalon and others are doing is really keeping the power of human connection, which is the critical success factor for aging successfully. So one of the things that we have going on, as you may know, if you've been reading, and we've been working on this project for over 10 years, is to build a new model of both living and care for older adults in Marin. And this is the rendition of our Healthy Aging Campus, which we've received approval for, and we will begin construction later on this year. It's in the corner of 3rd Street in downtown San Rafael. And the reason this is kind of a new model of care that we will have, this will be 100% affordable housing for people over the age of 62, 67 units of affordable housing in a community environment. And it's a car-free community because we can provide all the transportation. Older adults don't want to have to use their car as long as you can get them to where they can go, and we can certainly do that. And in the first 2 floors of this campus are a brand new state-of-the-art healthy aging center that includes a geriatric medical care clinic. So in one stop, older adults can come in, receive their medical care, and also get those other complementary things such as nutrition, transportation, healthcare, socialization, which are part of healthcare in what their needs are. So this is going to be a unique model. We hope that this one is well received by the community. And the fact is that imagine many of these around Marin and the areas needed for our older adults to live and get the services and support that they need in one particular location. A couple of comments to make before I turn it back over to Scott is that people have asked us, why did you change the name Whistle Stop, which everybody knows, and why do nonprofits change their names in general? Well, we have to listen to the community. And what we discovered is people knew Whistle Stop very well with our buses. And in fact, many people thought we were just a transportation services company. But as I've just shown you, we've had services covering rides, meals, classes, care, and advice all along the entire time frame. So we felt that we would keep the name Whistle Stop associated with the buses for our paratransit services that you see around the community. But now we have a name that covers all of the services we offer. Vivalon is an invented name. It's Viva for life and long for longevity. And the most important thing is, as I mentioned, in addressing isolation and loneliness, is this power of human connection. It works wonders. It's embedded in our ability to have a healthy aging and a very good quality of life towards the end of our life. Everyone should have that privilege and opportunity. So we've come up with the name Vivalon, and yet it's the same programs and services we've offered. And Whistle Stop, you'll still see that our Whistle Stop buses riding around the community, but we've now got a name that associates with all the depth and breadth of services that we offer. The last thing I want to mention is, as Scott mentioned, I am retiring on February 26th. I turned 70 years old. I've been with Whistle Stop, now Vivalon, for over 12 years. And we've had a 3-year leadership transition plan in place with the Vivalon Board of Directors that we've been working. And I'm pleased to announce that in January, we had a new CEO, an incoming CEO join us. Her name is Ann Gray. I know she's somewhere in the audience listening today. And we're just so excited to have Ann join Vivalon. She brings a breadth and depth of services and nonprofit leadership. She's worked with the Alzheimer's Association and other healthcare organizations around the field of aging. And she's supported by a very solid executive management team we have. The biggest challenge we have is there's demand for our services continue to grow as the population ages. We just have to build the capacity to be able to help more and more individuals and their families as they go through the aging process. So on behalf of Vivalon and myself, I want to thank you for listening, and certainly be around to answer questions. And I'm going to turn it back over to Scott. Thank you.
Thank you, Joe. So am I right that I heard that after you retire, you're going to be opening a microbrewery in the new senior center on 3rd Avenue that you'll be able to? Yeah, okay. I look forward to seeing.
I will. It'll have to be an Irish pub because that's my Gaelic spelling of my last name. So we'll make it right close by the new Healthy Aging Center. But it'll be healthy beer. It'll be healthy beer.
Very good. All right. And last but not least, certainly our third guest, Diana Lopez, currently the Vice Chair of the Marin Commission on Aging and a member of the San Rafael Age-Friendly Task Force. Diana worked as a manager, consultant, and project manager for the Kaiser Permanente Group for over 20 years and served as Director of Linguistic and Cultural Services at the Kaiser Center in San Francisco. After retiring from Kaiser, she retrained as a patient navigator with the integrative health a patient navigator with an integrative health specialty. Forgive me. In that role, she supported clients with chronic diseases, family challenges, and wellness and prevention goals. It's my pleasure to welcome Diana. Take it away.
Thank you very much, Scott. And thank you to the Marin Coalition. Good morning. My name is Diana Lopez, and I am here as a member of the Marin County Commission on Aging. I represent District 1, Supervisor Damon Conley's district. The Marin County Commission on Aging was established in 1977 to provide assistance and advice to the Marin County Board of Supervisors and the Marin Area Agency on Aging, and to advocate on behalf of older adults in Marin County. We have a 23-member commission. 11 of the members of the commission represent Marin cities and towns, and 10 members represent the 5 supervisorial districts. And we also have 2 members that represent the California Senior Legislature. Our general meetings are held on the first Thursday of the month from 11:15 to 12:30 p.m. And prior to COVID, our meetings were held all throughout the county so that we could travel. But right now, as most of us are doing, our meetings are held online via Zoom, but you're very welcome to come. Most of our meetings are preceded by educational presentations on subjects that are relevant to the lives of older adults in Marin. Additionally, we have 5 working committees: the Planning Committee, Housing and Transportation, Health and Nutrition, Legislative, and our newly minted Equity, Outreach, and Advocacy Committee. Each of the committees often has their own presentations, educational presentations. So please look on our website for those offerings. And of course, we invite you to attend and participate in our meetings and encourage you to become members of our committees. You are all our constituents, and we need to hear your thoughts, your concerns, your ideas, so that they can be reflected in the work that we do and the policies that we put forward on behalf of older adults in Marin. I will put my contact information in the Q&A if anyone would like to get a hold of me directly. What I'm going to focus on today quite a bit is the California Master Plan for Aging. And the reason that I'm doing that is that the plan is just out. It came out on January 6th, and it's a powerful plan and has a lot in it for every older adult in the state and in Marin County. As both of the previous speakers mentioned, the aging is changing, and it's changing California. The over 60 population is projected to diversify and grow faster than any other age group. By 2030, almost 11 million Californians will be an older adult, which will then be a quarter of the population of California. In June 2019, Governor Newsom issued an executive order creating a master plan for aging. And in the master plan, the idea was to prioritize the health and well-being of older California and to promote policies that support that. It also called for a blueprint for state government. This work, it was amazing. It was a huge lift. And as they started their work, well, after they got into their work, the COVID-19 pandemic hit, and they were really intrepid and kept working on it. And as I mentioned earlier, in January, the plan was published. So I'm going to share my screen now and talk a bit about, oops, sorry. There we go. Give you an update on the California Master Plan for Aging. The Master Plan for Aging is a plan that's a 10-year plan, but they have developed a number of initiatives for 2021 through 2021 and through 2022, I'm sorry. And the first goal is housing for all ages and stages. They're looking at more housing options. That includes production of housing in suburban, rural, and urban communities, such as accessory dwelling units. And many of you may know about the efforts to develop accessory dwelling units in Marin County, housing that's affordable and that supports aging and caregiving and is affordable. They're also, another one of the initiatives is to explore opportunities to increase the availability of housing options with Housing for Health. And it really ties into what Joe is doing with the project of Vivalon's project. Strategies, for example, to develop a Medi-Cal home and community-based service roadmap, including assessments of the availability of services, providers, residential care options with a new focus on Medicare innovation. And I'll speak about that a little bit later in the presentation. And also, they are going to assess needs for housing modification for aging, such as fall prevention programs. And those of you that may be aware of the fall prevention programs that are now available in Marin County. The second area that they're looking at is transportation beyond cars. They want to improve community walkability for older adults and people with disabilities, and to encourage innovation in flexible transit options. For example, demand response, especially, but not only in rural communities. So focus that is more of a West Marin focus, but equally important to everyone in Marin. Outdoor and community spaces for all ages. They're going to consider co-locating childcare and adult care, youth centers, adult centers, and schools and adult centers, along with joint programming such as arts. In the area of emergency preparedness, one of the initiatives is to develop online and other tools within existing resources to coordinate mutual aid for residents in residential living and nursing home facilities during emergencies. As you know, a lot of work is being done in that area, but more needs to be done so that we can be truly responsive to everyone that needs help during emergencies. And they're going to look at the impact of COVID-19, doing an after action analysis, including the impact on older, disabled, at-risk adults as one way to identify strategies to prevent future pandemic, emergency, and disaster-related deaths and disparities. So important work is going on in the area of emergency preparedness. In the area of climate change, the work is going to be done to factor in the impact and safety, including disaster resilience in new and rebuilt residential living and other age and disability friendly housing. We've had some issues in those areas that we've already had to face. They're going to reduce vehicle miles traveled and overall climate impact by aging and disability services at the state and local level. And climate readiness. Yeah, I included that in my remarks. So let's see. Health Reimagined. As Scott mentioned, my career was in healthcare and continues to be in healthcare. So this is an area of importance to me. And what they are proposing are ways to bridge healthcare with home, which is really essential. They're going to advocate to create universal long-term services and universal long-term services and support benefit, and assess the opportunities to work across state, local, and federal agencies to make that a reality. This is one area where in the master plan for aging, it really hasn't been fleshed out yet, but I'm sure that there are many people working on this, and that they'll work on it and hopefully make it a reality in the near future. They're going to look at ways to develop innovative models to increase access to long-term services and supports for people who are receiving Medicare only. In the area of healthcare as we age, we're going to modernize the Medicare counseling services, which is called HICAP, the Health Insurance Counseling and Advocacy Program, to serve more folks and continually improve cultural competency and language access within existing resources. I am a HICAP counselor, and the shift from in-person counseling to over the phone and Zoom counseling has been a fairly smooth one, but it really has changed the way that we provide counseling service to folks who need it. In the healthcare as we age area, another thing that's going to happen is it's going to include older adult behavioral health needs and in the behavioral health task force planning. It's an incredibly important area, mental health. It seems as if often older adults are left out of the thinking and planning regarding their mental health needs. Lifelong healthy aging. We're going to look for funding for a friendship warm line for older adults to address isolation and loneliness. Both Joe and Lee mentioned the great need for these kinds of services, and build in an older adult focus to existing suicide programs. Geriatric care expansion, and they're working on an initiative to include geriatric training in a new community paramedic initiative. In the area of dementia and focus, there's a lot of work being done in the area of dementia. Target clinical research into Alzheimer's on gender and race disparities. Promote screening and diagnosis and care planning by healthcare providers for patients and families with Alzheimer's and related dementias. And this is an area that is incredibly important, nursing home innovation. Continue to expand transparency on state data on nursing homes, including quality, staffing, financing, both in COVID-19 and after the COVID-19 health emergency is over, and re-engage stakeholders to revisit a pilot for small house nursing homes, an area that's incredibly important and critical. Goal 3 is inclusion and equity in aging. In inclusion and equity in aging, some of the work is going to be done towards diversity, equity, and inclusion goals for representation and aging disability departments and related state boards. Important work, and an area where there will be opportunities for people who are to volunteer, to work on these boards, to become active citizens in this area. Incredibly important work that needs to be done there. Many of us have heard quite a bit about closing the digital divide. There is the State Broadband Council has a new strategic plan to include older adults and using it through the lens of equity. And also to develop a plan to launch digital literacy support for older adults and providers. And an area that I work quite a bit in is opportunities to work. Many older adults have to work and continue to work. The idea that we're retiring at 65 is kind of fading into the background. Some of us need to work, some of us really want to work, and the work that's being done in this area highlights the work that's been done by the Future of Work Commission to explore ways to promote flexible work models, especially as people age, experience disability, or after they retire. There are many opportunities to volunteer and engage across generations. They're looking at opportunities for new intergenerational volunteerism partnerships in schools, and with philanthropic partners. Protection from abuse, neglect, and exploitation. The California Elder Justice Council is California Elder Justice Council is going to be created to increase coordination and develop recommendations to prevent and address elder abuse, neglect, exploitation, and fraud. California Leadership on Aging. The governor's office is going to create a leadership position on aging, disability, and Alzheimer's, because without strong leadership, not much really can happen. And they're going to begin the process to become an AARP, actually World Health Organization, and AARP, age-friendly state. The work that's being done locally, Lee referred to it, and there are many cities and towns throughout Marin County that have the age-friendly designation. Goal 4 is caregiving that works. Families and friends, caregiving support, and direct care job creation. The population in Marin is aging and will need caregiving support. Families provide a large amount of caregiving support, but there is also a large need for other caregivers, and we can develop that population of folks that want to work in those areas, train them, and get them jobs that make sense and pay a decent wage. And virtual care expansion, the telehealth due to the pandemic has changed so many things, the way we get a hold of our physicians, how we manage our healthcare, and it can also be used in conjunction with other caregiving services. And goal 5 has to do with economic security. It is essential that as we age, we have the opportunity to be secure economically. So many folks that I work with are having to leave Marin County because of the cost of living here. And they leave behind them their families, which are part of their support system. So this is an incredibly important goal. Homelessness, of course, needs to be addressed, and due to the pandemic and Operation Home Key and other programs that have been developed, some of those needs are being met, but that effort needs to continue. Income security, as we age, many people are just living on their Social Security, and it's very difficult to make ends meet. And also protection from poverty and hunger. A lot of the work that Lee Pullen and his department do address these issues and address them very well, but more work needs to be done in this area. We talk about all the things that we want to do and need to be done. And one of the most important keys to that is having money behind those. And I'm not going to read these, or, well, maybe I will highlight a couple of them because they're important in the world that I work in. But they are putting aside money. There's implementation placeholder of $5 million, a lot of money being put aside for Alzheimer's research. And as Lee talked about, the Aging and Disability Resource Connection, I've had the great privilege to work with some of the staff and assist in a couple of cases, and have been incredibly impressed with the work that the Aging and Disability Resource Connection folks do. And the long-term care ombudsman, it's been clear during the pandemic how incredibly important the work is that the ombudsman does. So there will be some funding for that. And as a HICAP counselor, of course, I'm always glad to see that there's going to be funding for the health insurance counseling and advocacy program. There is also federal funding that's going to become available at the state level. And these are just some of the allocations of funding that will that are going to be part of the funding for 2021, 2022. So I just want to put these up here so that you know that there is money behind the Master Plan on Aging. Then there is HR 33, which is the Consolidated Appropriations Act of 2021, focused on senior nutrition programs and elder justice programs, including the Ombudsman program. The main reason I wanted to talk to you all about what's going on with the Master Plan on Aging is that they're really going to need, the planning stage is over and the implementation stage is starting. And they need to hear the voice of the people in the community. So there are going to be new and refreshed committees and a number of opportunities for community involvement. The Master Plan on Aging, the California Department of Aging is putting together an impact committee, which is going to function as the board of directors, responsible for the accountability, transparency, and continued improvement through the life of the Master Plan on Aging. There's going to be a new Alzheimer's Advisory Committee and the Olmsted Act Community Living Committee, and the already established is the ADRC Advisory Committee. A lot of opportunities for those of us who are interested in these areas to participate. And I feel that it's very important that members of the community raise their voices and let the state, the local agencies know what they need and want in order to age well in Marin County. This is just a slide with relevant websites on it. And on this slide, you can see the Marin County Commission on Aging website. You can go to our website and see what we're doing, what presentations we're having at our meetings, and we absolutely welcome you and to come and join us and help us with our work and help with all the work that's being done around healthy aging in and around Marin County. Thank you very much.
Thank you, Diana, for taking us through all of that. Very comprehensive. Let me jump into the Q&A. So Diana, stay on screen. Thank you. And Joe, if you want to click back on and unmute yourselves. Joe, I think you're mute. Okay, there you go. Lee, you might want to unmute. There you go. All right, so we're back on. I'm going to throw these out. In some cases, we have questions for specific individuals. In other cases, the question would go to the panel. Let me start with Allison Buck's question to Lee. Allison writes, I manage Voyage Carmel Center, an independent program which houses seniors with SMI diagnosis. We have no access to the only board and care, St. Michael's, that works with behavioral health. What housing are you working for this specific population to move to who are not conserved but cannot live independently?
Thank you, Scott, and thank you for the question. One thing that I'm really happy that we have the mandate, and we'd be doing it if we didn't have the mandate, is reaching out and working with the community helps keep me informed, helps keep my managers and staff informed of issues that are out there. So in hearing this, I didn't know that Voyager Carmel, a great program, didn't have that kind of access. And I will say that I know that access is limited. Housing for all populations is extremely, everybody knows this, is extremely hard to find. And it's more poignant when we see people living on the street, so many older adults now living on the street, chronic homelessness and suffering also with the serious and persistent mental illnesses. I'm not especially working on a project for that particular population. I will say, in hearing this again, it is news to me and not news to me. Not news to me because I know we have this issue here in this county. But specific to Voyager, it's news to me that it doesn't work through your regular avenues. So I'm happy to follow up with you, and maybe we can discuss this with my cohort over in behavioral health.
Okay, next one also for Lee from Jean Gunn. In what ways was Aging and Adult Services able to pivot its resources to support the community during COVID?
Yes, a lot of pivoting. Thank you for that opportunity, Jane, to sort of talk about it, and just really appreciate our Aging and Adult Services staff. There are about 50 of us. We're part of the Health and Human Services Agency, so lots of dynamic things happening in this moment with public health and our director, Benita McLaren, and many, many community organizations. I want to go back and say that, the work we do, you want to build those foundations. And many years ago, Joe and I started something called the Aging Action Initiative and got funding from our Board of Supervisors to bring together aging services organizations to expand our network and to create a stronger infrastructure. And I really saw that play out in this past year when in my office, we were able to contact these community organizations and say, we're overwhelmed with calls. We're inundated, I should say, because we did keep our strength. We're inundated with calls for things such as nutrition and transportation to get medications and shopping and errands and those kinds of things. So we work with a lot of community-based organizations, without getting to so many specifics, to do that. And we have all been in disaster service roles. So we have done COVID testing sites. We're not going to get into the vaccine world. And all throughout that, we had this past summer and fall cooling centers and power outages and so forth. So it has been quite the year. And I'm just thinking, we're going to get through this and look back on it and just realize how much stronger we have become in this last year as community residents and organizations and people all working together.
We certainly hope.
Yes.
Scott, I'd like to add.
Sure, go ahead, Joe.
Okay, just wanted from a community-based organization like Vivillon and many of our partner organizations, we, like Lee described, we've had to pivot our services. As an example for us, our transportation, because people were staying at home as they should, dropped by about 75%. However, our other services, meals and reach outs, increased by over 50%. In fact, we've done over 350,000 units of service in the last 9 months, not only for older adults, but helping the county with other vulnerable populations. So we all have a responsibility for every member of the community to be able to get what they need during a pandemic. And what we did is offer our operating logistics support to the county and to other populations and other fellow nonprofits to use our transportation expertise, not to transport people, but to bring food to the community, to make sure that they had personal protective equipment, personal PPE and things. So we all the community organizations have done I think, an incredible job of continuing to provide these essential services to those in need in the population, in the community.
Sylvia Barry has a question for Diana. Diana, when you talked about the new committees, are they state or federal level?
They're state. And I think that participation on these committees will help make the link between the local communities, the state, and the federal government. And those are kind of this key process. I guess I'm speaking as the chair of the Ledge Committee now. Very, very important to make those connections and make sure that we take advantage of everything that's available to us to help folks age well in Marin.
We have another question for Lee from David Gabriel. Of the approximately 260,000 residents of Marin County, what percentage or what count aged, are undeserved and qualify for assistance? How many? I'm not sure what the diction is here. But
Underserved is, I imagine it's saying the question is saying underserved. So thank you for that, David.
Oh yeah, are underserved. Okay.
Yeah. And I think a couple of things in addressing that. One, so many of the public assistance programs have different eligibility criteria. So you could be a single parent raising 2 children, and that criteria is going to be different. You could be a single person with no job, no money, and your general relief is going to be a different qualification. What I do know of the 260,000, about 17 to 20% of the overall population receives Medi-Cal. So I think that's a good gauge when we look at poverty. So 17 to 20% of the 260,000 are receiving Medi-Cal. When we get into the older adult population, 60 plus, it goes down. So it's 5 to 7% of the population receiving Medi-Cal. And just when we say underserved, I'd go back to some of those earlier points around people of color and low income, to think in those terms as well.
Can I just jump in here for a second?
Sure.
And I forgot to let everyone know that the Public Authority Governing Board, which oversees the in-home supportive services program, is looking for members of their board. So that's an opportunity for folks. And also, I think last evening, this became open in the San Rafael, on the San Rafael Planning and Fire Commissions. So other opportunities available to people.
Yeah, and they just to add to that, Commissioner, they oversee the caregiver registry for the IHSS program, and it's really important. And Joe actually sits on the board, so it's a small world here. It's important to have people to advise our program. Yeah.
That
Scott,
actually leads
I'd
me
like
in.
to hit that.
Sorry,
Scott,
go ahead, Joe.
a little to Lee's response, and I know Lee, we talk about this all the time. People, what Lee was mentioning, that 5 to 7% really is federally qualified, but we have so much more need in Marin. The Elder Economic Index, which is done by UCLA, which kind of adjusts what it costs an older adult to live in a county in the state of California. Their number is in Marin is you need about $35,000 as an individual living alone just to cover your basic cost of living. And the average Social Security income in Marin is about $12,000 a year. So even though we have only a 7% population for the federally qualified program, we have thousands upon thousands that need our help in this community through what the county provides and organizations like we do. There's a lot of people that, as Diana mentioned, our older adults are having to move away because they can't afford to live here. That's not right. They built this community. They're the treasure of our community. And we and the county, and we all have to work together. As I said, we all share the responsibility that there are people that need our help in this population. And our job in the AAI, as we mentioned, is to really make sure that every issue in the community, economic, health, transportation, housing, you look at it through the lens of aging, because there are more older adults than most segments of the population that are being impacted in our community.
Kind of leads me to a question I had in my mind, which is, and this may be different for each of you, or there may be one common response that you all would give. Where would folks get in touch if they were interested in volunteering to do something for either of your organizations?
Joe, you can go first.
Yeah, sure. We have a workforce that supports our ability to serve over 14,000 individuals. We have what we consider a workforce of 400. 200 of those are paid staff, and the other 200 plus are volunteers. And we treat volunteers just like our members of our staff. They get trained, they get hired, there are specific jobs, whether it's delivering a meal or reaching out. So we treat them as our workforce, because we couldn't serve all of those thousands in need if it wasn't for volunteers. And the best way for us, and I think on any of the other, it's not just ours, it's the other nonprofits, usually go to their website, and there's usually, how do I volunteer? In ours, livealon.org, you can go in there, and there's an application, and we can match what your talent is or your need, what you want to do. We've all got jobs for people to be able to meet this growing demand of our elder population.
Yeah, and for us, the Health and Human Services in the county has an office for volunteerism for our programs. Two areas where we can use volunteers is in the long-term care ombudsman program that I mentioned, to help us and being out there in boarding cares and so forth, and providing support for those residents. We also have a financial abuse specialist team. This is a group of professionals, people who've been bankers or are bankers, real estate agents, accountants, and so forth, that help us, local law enforcement and the DA's office, look into situations of financial abuse and exploitation and so forth. They help us to go back and sort through all the documents, and really great benefit to lend our expertise. So if you're interested in volunteering in general, or something more specific to aging, just use that number that will be on the slide, 473-4636, the 473 info number, and tell them Lee directed you there, and they'll get to me. There's also opportunities within, just like Joe's place, many of our congregate sites, yes, they're closed down now, but to the question from Gene Gunn around pivoting, those community sites, when we weren't able to offer congregate, come and have a senior meal with us anymore, they took the funding that we had been allocating and did things like shopping and errands and telephone reassurance. And so we were able to pivot in that way. So those are great places to volunteer to help with food pantry distributions, lunchtime and so forth.
Terrific. Diana?
I will provide my contact information so that you can send it out to everyone who's been on this call, and just call me directly. It's one of the important pieces that the Commission on Aging wants and needs to do, is to help folks who want to do this kind of work find a place that works for them, where they really resonate, the work resonates with for them, and that they really love. So I will give Scott that information, and please feel free to call me directly. Thank you.
Let me please, Scott, just second this what Diana's saying, because there's sort of the thinking of helping doing hands-on kind of stuff. So that if that's what you're inclined to, we gave some examples. But there's so many opportunities with our Commission on Aging, with housing, nutrition, transportation, legislation, and members of the public are welcome to join any of those committees. You don't have the voting rights, but we would welcome you to join and work with us on policy and advocacy issues.
Yeah, as we move forward, we need to hear the voice of the people of the community. You have a lot of professionals doing X, Y, and Z, and that's all incredibly important. But unless we hear from you as an individual regarding what you need, then we don't know where to press in terms of our advocacy.
Good to know. All right, we will push that information out to folks, either through the website or emails or something like that. We'll figure that out. Time for a couple more last questions here. Stephanie Wagner, if I'm pronouncing that correctly, wants to know from Lee, with Accent, she is Stephanie with Accent Care Home Health in Marin, and her question is, what is the minimum age for the one-door program?
So it's open to anyone over the age of 60, needing what I had said around information assistance, or short term. It's not long-term case management, short-term service coordination to help in an more immediate situation. It's also open to persons with disabilities, really anyone over 18 with disabilities or functional limitations, family caregivers who are under 60, or someone trying to help out their family member who may be older. And if you just happen to call and don't fit that, I'm quite sure we'll direct you to where we think you can get some help. Very
good. And then I had another question. Maybe this can be our final one. I think we've gone through the audience questions. Tremendous amount of information each of you presented, and presented extremely well. And I thank you for your thoroughness and the detail that you gave on what your various organizations do. The thing that I was thinking as I listened to each iteration of your programs is, how do you interact? To what extent do you overlap? To what extent are you complementary? There's a whole lot of information we're absorbing here, many of us for the first time. And the thing that runs through my mind is there's a lot out there. These guys have probably figured out a way to compartmentalize it that's not obvious to us. Have you done that? And what's the interaction like? Anybody?
We're in a lot of the same meetings together. Joe, do you want to go first, and I can sort of talk about how aging and adult services spreads out?
You on the spot, have I?
No.
Well, obviously, Scott, the demand exceeds the capacity, and so we're all in this. There's plenty of work to be done by so many organizations, and that's why Lee and I, formed the Aging Action Initiative. It has, I think, Lee, we're up over 250 organizations coordinating together. And that's the important thing, is that if there's an older adult in West Marin or East San Rafael or Novato or Sausalito, that they have access to the same information and services that we can offer to anybody in any of those geographic locations. So that's the purpose of the AAI, is to really have a collaborative initiative It's made up of community-based organizations, healthcare organizations, the county Marin Community Foundation. In other words, we're trying to really represent as I said, the lens of aging through the community, because every issue, as with all this age-friendly work being done, really is addressing, what these older adults need. So we do a lot of coordination and collaboration. We don't have to keep reinventing the wheel. It's more strength in numbers that we look for in our AAI, and the ability to really make sure that no one, as the one door approach, that service coordination and advocacy become very paramount for the aging population in Marin.
Yeah, Lee and I work very closely together. He works closely with everyone on the Commission on Aging and supports our work and sort of keeps us in line. I think of him a little bit as my boss, and it's very much appreciated. It's a good way to work, and we as sort of citizen volunteers really want to bring the voice of the people of Marin County to the services that are being provided. But I have nothing but I think the work that you all do is incredible, and I'm so very grateful to both Lee and Joe for all the work that they do.
Yeah, and saying back to you, Diana, I mean, I think if you took any of the we have a couple of vacancies right now, but the 23 members of the Commission on Aging, it's tied for the largest in the county's government structure. Any one of those commissioners you're going to find is involved in many things, not just doing their work. There is so much crossover. It is really true that we all see each other at the same meetings, whether it's disaster preparedness or food distribution or what have you. So I think the network is well connected there. We always welcome more people. From a government standpoint, government funding, for me in our office, we have mandates to do things like provide home delivered meals. So we can't do that unless we're able to contract out in the bidding process to organizations that will do that. So Vivillon's our current contractor, and there's examples from those logos that I gave you earlier. So that's how we stay connected with the funding and the priority areas that we need to meet.
Very good. All right, folks, I think we're going to need to close it out. I would again like to thank our three guests. We were pleased to hear from Diana Lopez, Lee Pullen, and Joe O'Hear. Am I saying that right, Joe?
Yes, you are. Very good.
Okay. We want to thank all of them for sharing their experiences. I think we all learned a lot. We've recorded today's program, as I mentioned. That'll be available on our website in the coming days. Usually it takes us about a day to get that up. And we welcome you to log in. Share it with your friends if you'd like to, and let folks know what's going on in this issue for Marin County. It's a big one. Want to remind you again, our next event, David Kuhnhart on climate change, realities and solutions. That will be Tuesday, February 16, 2021 at noon. And finally, I want to give a thank you again to our webmaster and host, Alan Shavitz. Alan, can you come on the screen for a second and just let folks know how we will be getting the slides and the information and data out to them? Will that be on the website, or how do you want to do that? You're muted, by the way. There you go.
Yes, it will be on the video. Will be on the website. Any connections that contacts, web links, whatever that you guys provide, I'll add that to the posting that describes the video.
Okay, terrific. Thank you all again. Thank you, Alan, for another great session. We look forward to seeing you all in the coming session next month. Hopefully the weather doesn't treat you too poorly, and stay safe. We'll see you next time. Thanks for joining us.
Thank you.
Thank you all.